I've no idea where this comes from. I think this is a bit of an urban myth, this issue that there's potentially a problem with flying. Now, if you've got reasonably stable ITP, there's really no particular platelet count that which you should be striving to achieve before you can fly. It's a safe sort of process.
Welcome to Beyond the Count. I'm founder and CEO of ITP Australia and New Zealand and your host, Danielle Boyle. This is a space created for the ITP community by the ITP community, where we share real stories, expert insights, and everything in between. Whether you're living with immune thrombocytopenia, supporting someone who is, or just curious about what life looks like beyond the bruises and the blood tests, you're in the right place. So whether you're driving, out for a walk, folding the laundry, or just sitting back and tuning in, let's dive in and go beyond the count. In today's episode, I sit down with Haematologist Dr Rob Bird, who answers some of the most frequently asked questions we receive from our patients. Everything from dental visits, diet changes, to flying, fatigue, and even fitness. This episode is packed with some practical advice and insights, and I know that you'll find it really helpful. I'm especially excited to share this conversation because we know how confusing and isolating it can be when trying to make day-to-day decisions while living with ITP. Dr. Bird provides an easy to understand and straightforward way of explaining everything, which isn't just grounded in science, but it's filled with some real world relevance as well. So let's get into it. Thanks, Rob, for joining us today. So what we're going to do is we're going to ask Rob a couple of questions around the common questions asked around ITP. I'm going to start with dental. So what do you need to visit the dentist, whether it's for a general clean checkup or, fairly decent major dental work? Is there a guide?
Look, there is, but it's very rough. I mean, I guess the thing is with ITP, there'll be a person who has a platelet count of 20, has a bruise or mark on them. Then there'll be other people with the same platelet count who will bleed. So while we can give platelet counts as a general guide, it does very much depend on your personal history. So generally speaking, to go to a dentist and get a clean and scale, in other words, just a general checkup, it's recommended that you have a platelet count of greater than 20. For simple dental extractions, and by simple, that would really be the incisors, teeth, platelet count of greater than 30 is recommended. And for more complex extractions, so that would be the back teeth or the molars, really a platelet count of greater than 50 is required. But look, my oldest son's a dentist, and I've sort of spoken to him about these things. And, there's dental extractions and there's dental extractions. Some teeth come out really easily, 5 minutes, it's all over. Other times it's sort of an hour of relentless struggle in the chair for both the dentist and the patient. So there is a bit of variability, but I think the important thing is let your dentist know you've got ITP. Don't turn up and just assume everything will go well. Certainly, I find not infrequently dentists will contact me if they've got patients with ITP just to get some reassurance. And the other thing I'll just comment on is people do get gum bleeding. People without low platelets get gum bleeding, and really the most common cause of gum bleeding is not a low platelet count. It's really gum disease. And gum disease really needs a proper sort of a dental scaling. And so it's normal to get gum bleeding when you get dental scaling, whether your platelet count's 20 or 250. But if you are regularly bleeding following brushing your teeth, it may well be that you've got gum disease really, rather than just reflecting low platelet counts. So paradoxically, that is a reason to go to the dentist and get everything cleaned out, and which obviously at the time may make things worse, but then is likely to settle things down. And just one other thing he said is, obviously, I think you don't want to be using a hard toothbrush, and there is apparently a skill to brushing your teeth. I'm not sure I have it, but that can be sort of largely offset by using an electric toothbrush, because then really the brush does all the work rather than your elbow doing the work. So if you haven't got a good dental, toothbrushing technique, using an electric toothbrush, and you can get them for as cheaply as $20 these days, is a fairly good way of letting the brush do the work without causing as much trauma to your teeth as sort of a standard manual toothbrush would.
That's wonderful. Is there anything that you can recommend, obviously, other than going to the dentist and checking for dental gingivitis or something like that? Is there a mouthwash to help with bleeding gums if it is ITP related? Because I know personally, when my counts are low, I've got bleeding gums, but generally when my counts are fairly good, they're not necessarily.
Yeah, look, you can use tranexamic acid. It's not so good as a mouthwash because then, the drug is only just in contact with your gums very transiently. If you are bleeding from, similarly, if you have dental work or tooth extractions, then tranexamic mouthwash soaked in gauze pads and just applied to the area of bleeding can help. But again, I wouldn't just assume it's low platelets. If you are regularly bleeding from your gums, it's likely you have some gum disease. So I'd get it checked out and just don't assume it's low platelets because it might be something that can be readily fixed by a trip to the dentist. So in other words, you want to treat the underlying condition really, if you can, rather than just the symptom.
Not the symptom itself. Yeah. Okay, moving to travel. What are your recommendations when it comes to having ITP and safely flying?
Look, I have no idea where this comes from. I think this is a bit of an urban myth, this issue that there's potentially a problem with flying. Now, obviously, if you're at a plane and it goes down, whether you've got ITP or not, you're in big trouble. And if there's an emergency decompression, which is where, like a window blows out, you can get a massive decompression. That's like diving and coming up quickly. You can get what's called barotrauma, which is sudden decompression. But really, just routine flying, it doesn't really present a substantial bleeding risk. So I think rather than the process of flying, which really is not intrinsically dangerous, is, if you're someone with really unstable ITP, it's really where you're going to. And the fact that on the way there, whether it be in a plane or some other mode of transport, you might be in a situation where if things are really dicey, you're not in a position to get help if you need it. But obviously, I would hope that most people with really unstable ITP or any other disease wouldn't be taking the risk of flying. But, if you've got reasonably stable ITP, there's really no particular platelet count that which you should be striving to achieve before you can fly. It's a safe sort of process. Obviously, with long haul flying, there's a risk of prolonged immobility. If you don't take enough fluids, you might get dehydrated. And ITP, as I'm sure most people know, does confer a mildly increased risk of blood clots, despite the low platelet count. So if you are on a long haul flight, I think the important things for people with ITP, as well as people with no health issues, is to get up and walk around as much as you can, keep your fluid intake up. And I do not refer to alcohol, I refer to water or similar. Really, keep a good fluid intake up, keep moving. Most of the flight magazines will have some little exercises suggested that, keeps the circulation going. But, do those things, common sense things for anyone who's traveling long haul, really. But in terms of ITP and flying, I wish I knew where this came from because, there really isn't an increased risk of bleeding unless something, catastrophic happens on the flight and, everyone on the flight's in trouble. That in that case, not just those with ITP.
Yeah, no, it does come up quite a lot actually in the when patients are sort of talking amongst themselves, or if someone's about to go travelling. Things like travel insurance, which is generally readily available for ITP patients now. Even travelling, to lower socioeconomic locations like Thailand and that sort of stuff as well. It's still available. It is available, which is great.
Yeah, look, the other thing, I guess, is if you do have to take medication with you, it's probably as well to take a letter just from your treating doctor, just certifying that the medication's needed. And possibly if you're going to a country where, English is not commonly spoken, it might be worth getting some kind of translation. But yeah, aside from that, I would certainly encourage my patients with ITP who want to travel, just to discuss it, to see whether, it's a safe journey to take. We have quite a network of ITP specialists around the world, and certainly when people have travelled before to various points in the world, people who would need treatment while they're away, we can often tee something up. So just talk to your treating specialist. If you've got problematic ITP, because we can often facilitate treatment overseas rather than having to go through an emergency sort of process.
Yeah, well, that's great. Okay, moving on to food. This is generally a fairly big topic. Loads of people, swear by diet changes, cutting out gluten, having things like papaya leaf extract. Have you experienced anything that's sort of outside of the ordinary particular minerals, vitamins, supplements, that sort of stuff that can help?
Look, I guess the thing is, for the most part, unless you have a specific deficiency of the vitamin, taking more of the vitamin that you're not deficient in really isn't going to make a substantial difference. And in some cases, you can run into trouble with, like, for example, nicotinic acid, which is now being sort of promoted as a cure to, as a drug which can sort of resist in eternal life. If you take too much of that, it can actually cause thrombocytopenia. So really, there's not a lot of role for vitamins unless you're vitamin deficient in boosting platelet function or boosting platelet counts. Similarly, there's a whole load of sort of mythology around things that interfere with platelet function. So certainly there are some dietary supplements, or there are some herbs, for example, that if you take them in large quantities will have a minor impact on platelet aggregation. That is, the platelet's ability to stop bleeding if you cut yourself. But for the most part, really, so for example, onions, blueberries, garlic,
turmeric as well, I've heard. During that period that there was that turmeric coffee, everyone was, oh no, you can't have it. It's like, well,
yeah. Look,
I'm going to have a chocolate, right? So for it to actually impact. Well,
you would. That's absolutely right. Look, if you somehow can invent a process to sort of distill whatever it is. So most of these things like onions, ginger, they have a specific chemical in them, which if you could purify it and concentrate it and take it at, a level which would be far higher than you would get just by eating these things in normal quantities, they may have an antiplatelet effect, but you'd have to eat sacks full of onions, or as I say, have some kind of bizarre distillation process going to extract that chemical and concentrate it and take it for it really to make a difference day to day. So look, if you want a bit of garlic or onion in your stew, go ahead. It's really not going to make a difference apart from make it possibly taste a bit nicer.
I know, I'm Hungarian. We can't stay away from onion and garlic and that sort of stuff. So no, I don't think I could survive without those ones.
Yeah, look, there are specific drugs, that have antiplatelet effects. Obviously, aspirin, clopidogrel. There are many drugs like the non-steroidal anti-inflammatory drugs, which if you take them long term will have an antiplatelet effect. So you really need to be avoiding those sorts of things long term anyway. But most dietary supplements have a very modest effect on platelet function, and as I said, unless you're going overboard with them, it's highly unlikely to make any significant difference. So I certainly don't think common foods that you can buy at the supermarket and eat in normal quantities, I don't think we really need to be avoiding any of those.
And obviously, talking to your clinician and depending on what treatments you're on as well will impact that as well, I suppose. So
there are certain drugs, there are certain things where, grapefruit or Seville oranges, for example, contain a substance that can interfere with the metabolism of certain drugs. None of those are commonly used in ITP, but, there are certain drugs where, fruit has a chemical in it that interferes with their metabolism, but you will generally be informed about those things when you start taking them. And obviously, if you're a person who takes L-Trombopag for ITP, there's a whole load of things that can interfere with the absorption of L-Trombopag or Revelade. So divalent cations, which are things like iron, zinc, copper. People can start taking supplements, for example, because they think they'll help, and they can actually do the opposite to what you'd like. They can stop the absorption of L-Trombopag. So again, if you're thinking of starting a supplement for your general health or for your ITP, really just check with your specialist first, because you may inadvertently be taking something that could, adversely impact, not through a direct effect, if you like, but by a sort of indirect effect of really limiting the absorption of the treatment that's supposed to be helping you.
Thanks to our sponsor Sobi for their ongoing support of ITP Australia and New Zealand and our podcast Beyond the Count.
Okay, so moving to exercise, do you recommend patients not engaging or, participating in certain types of exercise? Obviously, the benefits of exercise from a mental health perspective are quite good, but do you have any recommendations there at all?
Yeah, really, you want to avoid in contact or impact sports. So things like rugby, gridiron, boxing, or sports like horse riding, where if you do have a fall, you could get quite significant injuries or trauma. But certainly things like walking, jogging, swimming, those sort of aerobic exercises, rowing, absolutely, I would encourage people to exercise using those sports. It's really those high impact sports, sports where you're essentially trying to injure people. Don't put yourself in harm's way by engaging in those sports. Do something, aerobic type exercises, running, walking, swimming, rowing, plenty of options.
Yoga, all of those sorts of things as well. Because obviously the benefits of those exercises can help help alleviate some of the side effects when it comes to things like steroid use and, those sorts of things as well, and the anxiety felt by patients just in general with ITP.
Look, I think there's evidence across the board in a whole number of chronic illnesses beside ITP, but showing that if your general level of fitness is good, you regularly exercise, you just feel a lot better than if you're not exercising. So I would certainly encourage people to exercise, stopping short of those contact sports.
Wonderful, wonderful. Okay, in general, we all there have obviously in the I Wish survey we found that fatigue was experienced by quite a lot of patients and a big proportion of patients. Is there anything that that patients that you think that that they can do to help alleviate that fatigue, or is it just a sort of sit, relax, listen to your body type messaging? Or
look, it is tricky, but the fatigue seems to be a common symptom in ITP. It's some people I look after absolutely can predict their platelet count by how they feel and get very fatigued with the low platelet count and feel better when it's higher. However, that's not a consistent feeling, and there is something about the disease process maybe that makes people fatigued, because there are other people that you can treat a low platelet count, improve it, and fatigue doesn't always improve. So there's not always a clear correlation between platelet count and degree of fatigue. Treatment with steroids or with romiplastim or atombopag may not necessarily improve fatigue. So it's a tricky one. Look, I would say, fatigue is a very difficult thing to deal with when you've got it. But I would say, if you can, try not to give in to the fatigue, try and keep up a level of exercise and activity. Because I think one of the risks of fatigue is you do less, you don't feel any better, you do even less. And then, you get to a really low level of fitness and deconditioning, and then it's really hard to get going again. So irrespective of the fatigue, if you've really become very sedentary and try to get going again, it becomes even harder. So I'm not saying really push through your fatigue to ridiculous levels, because that can make things worse, but just try to keep going with those daily activities. And if you can, a bit of gentle exercise, because, if you give in to these symptoms completely, sometimes it can be very hard to, pull yourself out of that hole and get going again. And look, it's hard to say. Look, obviously, in some people, you might be worried about, you shouldn't exclude other things like, depression could be a contributor. So that's something that might be worth discussing. Now, your haematologist is not necessarily going to be the expert in depression or management of depression, but certainly it's something that, if you bring that up with your haematologist, it might be worth seeing a psychologist or even a psychiatrist if depression could be a factor.
Okay, one of the big questions and big comments that I suppose that are asked of the Australian patients especially is that, okay, so I'm now experiencing, I don't feel myself, I'm experiencing an increase in symptoms. Should I wait and see? Should I go and seek medical advice? What's your recommendation there?
So you're saying if someone with ITP develops some new symptoms? Look, I guess the thing is, if you've had ITP for a long time, you're probably very familiar with the symptoms, which suggests that your ITP might be getting worse. But if you're relatively new to the game, you may not recognise those symptoms as indicating worsening of ITP. I would say, get a blood test, see if you can, get along to see your doctor. It's better to be safe than sorry, and pick these things up early rather than just let things, progress and get worse. So, if you get any new symptoms, you've got a chronic disease, really get them checked out. If they're, if you're already familiar with them, certainly if you've got symptoms suggesting your platelet count might be very low, again, just get in touch with your treating specialist and, hopefully things can be headed off before they get worse.
Yeah, better to be safe than sorry, I think.
Yes. Okay, thanks, Danielle.
Thanks so much for joining us today.
All the best.
I hope you all got a lot out of today's episode. Now, before we wrap up, here are 3 key takeaways from the episode. Don't assume bleeding gums means low platelets. It might be gum disease, so it might be a good idea to book in for a dental visit and let your dentist know that you have ITP. Exercise is definitely encouraged. Avoid high-impact sports, listen to your body, and always talk to your healthcare professional about anything that you're about to do. Travel is safe for most people with ITP, but always check with your haematologist before you head off, especially if you're heading overseas, and even consider travel insurance. A big thank you to Dr. Robert Bird for generously sharing his time and his expertise with us today. And a huge thanks to SOBI for supporting the Beyond the Count podcast and the wider ITP community. If you're looking for support, join the ITP community at itpanz.org.au. While you're online, check out the latest edition of The Count, our quarterly magazine. Read some of the great patient stories we have in our news section. Download a huge range of treatment information, guidelines and more in our patient resources section, and know that you are not alone. We are here to support you. We are here to provide you and inform you with all of the latest information when it comes to immune thrombocytopenia. If you found this episode helpful, please share it with others in the ITP community, and don't forget to leave a review on the platform you're listening from. It helps others find Beyond the Count. We've got more expert conversations coming your way really soon, so hit the follow or subscribe button to stay updated. And thanks for tuning in and diving Beyond the Count with us.